Hi, me again, Dr. Dustin Dippin here. I just wanted to make a video about diagnosis. There's a lot of ambiguity, of course, in how we diagnose things, what diagnoses mean, what they should be, how they dictate treatment, or how people should understand them, how they should kind of integrate that understanding into their lives. Each diagnosis is, of course, unique, but I just wanted to generally talk about our system of diagnosis a little bit. So first of all, our current system of diagnosis is mostly based upon the Diagnostic Statistics Manual version 5. There are ICD-10 codes that are used for billing more so that correspond. I just want to say, in terms of sort of philosophical bent, my own bias, one of my favorite jokes is 60% of statistics are made up. Let that settle in for a second. 60% of statistics are made up. It's a joke, meaning that, of course, some degree of what we understand and try to quantify with mathematics or research is something that is difficult to quantify. My biochemistry teacher, when I went to naturopathic college, said something really wise that always sticks with me, and that's science is our best guess, our best attempt at understanding things that we cannot explain on our own. And he related our modern efforts at biochemistry and physics to that of Greek mythology, in which these stories that were created were essentially created so the ancient Greeks could explain things that happened, either that they observed in their physical universe or culturally that happened amongst the people. And I think that psychiatry, psychology, diagnoses of mental health disorders is very similar to this. I often say with patients, there's no x-ray I can take, there's no MRI, there's no blood test that says you have bipolar disorder or schizophrenia or PTSD or ADHD. Now, people would argue that. They would say, oh, there's certain correlative brain studies on MRI or CT, and there's certain doctors that would use an MRI to determine which antidepressant to start. Certainly there's some research out there that demonstrates changes in the way the brain looks with an MRI, either after the effects of antipsychotics or before if someone has schizophrenia. But we don't use those tools to diagnose these things in everyday clinical use. Sometimes they can be correlative. They can show us, oh, there are these changes in the physiology or the body, the brain, but we don't sort of get an MRI to determine if someone has paranoid schizophrenia. That's based upon symptoms that they tell us they have. So, there's a lot that we could unpack here with this concept, but basically, in layman's terms, the way that we diagnose stuff is we look at this book and we see the collection of symptoms that are next to each label, and if the person tells us, or we can observe, or other people have told us reliably that the patient has these symptoms, then we'll say, oh, they meet criteria for that disorder. And if they no longer have those symptoms, then we would say, it's in remission, or they no longer meet criteria for that disorder. That's sort of how this works. And a lot of people see this as flawed. One reason that it could be seen as flawed is sometimes you'll see people come in with 7 to 10 diagnoses. And at some point in their life, maybe all of these things were true in terms of these symptoms were observed and grouped together. And some clinician thought, okay, you have ADHD or panic disorder or PTSD or bipolar disorder or borderline personality disorder, or all of the above. This kind of lends us to the argument that some people were making when DSM-5 came out, which is that we should have a system of diagnosis that's more dimensional in terms of looking at a human being as a whole person, that you may have some of these things, little bipolar tendency, little borderline personality disorder, some trauma, that some PTSD symptoms. Maybe sometimes when you really lose it, you feel like you're hearing voices or seeing things, and that would be like a psychosis dimension, and that seeing someone as sort of this big pie chart or conglomeration of all these different dimensions that come together to make them uniquely them would be more accurate than simply putting a label on them, or 7 labels or 3 labels or 5 labels. That would be sort of a more comprehensive way of grading the different aspects of what they're experiencing and having a more holistic picture of who they are as a person. So that is a different sort of diagnosis that is not in place, but even like the UVM Child Psychiatry Department argued very heavily in favor of this type of model of diagnosis rather than the DSM-5. So even sort of locally in our state culture, this has been something that's been argued that should be more standard and useful in diagnosing people. One thing to note is that where diagnosis becomes kind of problematic is not only for the person's understanding of themselves, but also because often to meet criteria for an inpatient hospitalization or to meet criteria to start a certain drug treatment or to meet criteria for a certain level of service, someone has to have a certain diagnosis, and other diagnoses don't count, and this one does. And so that's where it gets really tricky, because they have sort of a legal and ethical framework, and yet it may not really inform the person's understanding of their own mental health, as well as it does inform sort of the insurance company whether or not this is valid, or the local mental health agency whether or not they qualify for a certain service. Or in a school setting, someone has ADHD or autism spectrum disorder or learning disorder, they're more likely to qualify. Anyway, there's a lot more I could say about this. I guess I just want you to go away from this understanding that the system of diagnosis we use is kind of under question. There's a lot of subjectivity to it. It may not be ideal. It's what we certainly use to diagnose people, but always kind of keep in the back of your mind, we essentially made up all of these things, a group of people did, and this is the 5th edition of the group of labels that we've created, and we think mostly explain what we're observing. But for the most part, there's not a lot of objective proof of any of these things, other than sort of validated psychological tools or checklists that we use to sort of assess history and current symptoms. So I'm over my 5 minutes again, but I hope this was helpful. I'm happy to make more videos like this. Take care of yourselves. Bye.